We welcome to the program Robert Dozier, Executive Director of the Mississippi Independent Pharmacies Association. Robert, good to have you on. Good to see you, sir.
Good morning.
So CVS, a very large operator of pharmacies, and of course they're into a lot of other things too. They don't just dispense prescription drugs. They are working on a model that they intend to implement that really revamps the way prescription drugs are priced. It's very complex. I think the average person doesn't understand it, and there are a lot of moving parts. I've shared with you before that I have just viewed flowcharts, if you will, graphic depictions of the route and the flow of pharmaceuticals and drugs from the manufacturer all the way to the end user, and you just start turning it like, which way do I look at this thing? There's so many moving parts, so many entities, so many back and forth. It just hurts your head. Look at that. Tell us what CVS is doing here, how they're changing this model.
Well, I agree with everything you just said a while ago. And the problem that we see in the prescription drug world is you have too many hands out in there, too many middlemen, and it is a very complex model. And for the past 2 years, our association has been pushing a reimbursement methodology that does just this. We're down at the legislature, and I think you're a little bit familiar with it.
Yeah.
It's basically a cost-plus methodology, and it adds a lot of transparency to it. Well, here we are 6-9 months later, and all of a sudden CVS announces they're going to a cost-plus methodology to add more transparency. The reason why the PBMs and Express Scripts is
Pharmacy benefit managers for the benefit of our audience.
Pharmacy benefit managers. The reason why they are all of a sudden now preaching transparency and preaching a cost-plus methodology is two reasons. One is the federal government, Congress, and the FTC are having a lot of hearings to talk about this scrutiny and this opaque business model that the pharmacy benefit managers act under. And then the other thing that's also driving this is Mark Cuban's cost plus health plan out there with prescription drugs. Yeah. So if you take any normal business out there, it's based on a cost plus methodology. You go to the grocery store owner, he pays $5 for that gallon of milk, then he marks it up to maybe $8. And, that's a cost plus methodology. In the prescription drug world, it's the wild, wild west. We really do not know what that drug costs the end user.
So you're saying but what about the retailer? What about the CVS? Surely they know their income and landed cost of the drugs they're retailing, they're selling.
Now, someone like CVS, because they are also paired with a pharmacy benefit manager, Caremark, they're one and the same. Yeah. They're going to know more than an independent pharmacy out there. Okay. Because the independent pharmacy, they know what their cost is, but they never know what they're going to be reimbursed because the PBMs are in charge of the reimbursement. And I just kind of dumb it down for you real quick. It's kind of like your competitor is setting your reimbursement. It's kind of like McDonald's being the competitor to Burger King, and McDonald's is telling Burger King how much to charge for the Whopper.
That's broke.
Yeah, it is. It is
so
a broke system. So let me ask you
this then, Robert. Do situations occur where, let's say independent pharmacies, let's start with them, and it may or may not be different with respect to an independent and a large chain like of CVS and Caremark. All right, did they retail drugs, prescription drugs, and perhaps the user, the patient, may have a copay that they'll pay cash for at the point of sale, and then the pharmacy files for reimbursement with the patient's insurance provider, right?
That's correct.
And then they get reimbursed. Do they have situations where, based on what you said, they don't know, where they're upside down, they file that, and they get reimbursed, and it's less than what they expected, thus the amount that they charged was wrong?
All day long.
That's crazy.
And so what we proposed to the legislature this past session was a cost-plus methodology based on a true transparent number that is set by an independent third party. Okay. It's called National Average Drug Acquisition Cost. And we were going to say, hey, let's go to this NADAC model, plus a professional dispensing fee, everybody knows what cost is going to be. And that is one of the things that I'm afraid of or kind of worried about with this new CVS plan is they're saying, hey, we're going to use cost plus a profit and plus a dispensing fee. Now, CVS is going to be the one who determines cost. So really, have we changed a whole lot? So we have to have a national transparent benchmark out there because if we allow them to say, well, they're going to do this new model, a cost plus transparent model, well, it all gets back to who is setting cost and what is cost.
Yeah, it's very much tantamount to my discussion in the last segment about defining income. What's income? So here we got a situation where, okay, how do we define cost? Because I could see where that could take a life of its own when you start talking about pharmaceuticals and prescription drugs.
That was a lot of the pushback this past legislative sessions. The pharmacy benefit managers, they did not want to use that NADAC cost plus methodology because they were not in control of cost. And so what we have to do is we have to find a transparent benchmark that's out there that reimburses the pharmacies an adequate and fair reimbursement and help save money for the business community, the business corporations that are helping pay for the employees' health care costs, but mainly to help the patients, the end user.
Your term opaque comes to mind, that maybe the PBMs like the opaqueness of the cost.
They do. And it is set up that way to confuse everybody because the way the PBM business model is set up is to benefit just the PBMs. If they went out and, their big message is, hey, we're helping reduce prescription drug costs. Well, Gerard, you're a very smart man. Tell me how the prescription drug costs have gone down in the past 10 to 20 years.
Well,
it hasn't.
They clearly haven't. And, of course, there must be value in the PBM industry because it's, as you know, we've seen lots of vertical integration where the large healthcare insurers who essentially have their profit limited by federal law have said, okay, we're going to go expand and diversify into a new business that doesn't have federal limitation on profit. Boom, PBMs.
Correct. Now I'm going to give you something to think about here real quick. The current presidential administration, they are negotiating 10 drugs with the drug manufacturers.
Yep. Medicare.
That's correct. And the PBMs are in the Medicare Part D plan out there, market. If the PBMs were doing such a good job, why is the federal government having to negotiate privately on 10 drugs?
Well, the whole concept of negotiation for allowing or enabling, really, Medicare to negotiate is confusing upon itself. I mean, it seems to me more like the federal government wants to say, we're going to pay this much for this and this much for that. That's not really a negotiation. Explain that to us. What's the deal here? What's the teeth here? It's
kind of like what the PBMs do to the pharmacies out here.
Okay.
They throw a contract out there and they say you either sign it or you don't. There's not any real negotiation, of none whatsoever. I talked to a guy the other day. He's been in the independent pharmacy business 47 years, and I said, how many times have you negotiated with a PBM? He said, never. So that speaks volumes right there. And it's the same thing with the federal government. They're going to these drug manufacturers and saying, hey, this is what we're going to pay, and that's it.
Well, I mean, the president's bragging a lot about how he's driving the cost down of prescription drugs because of that provision. Mm-hmm. Is that going to be the case? I mean, can we expect that? The Medicare primarily.
Yeah, and I'm still up in the air on that. It's going to take several years for this whole thing to work out, especially when you start dealing with CMS and HHS and all the federal bureaucracy. It's going to take a while. But the thing is, this whole prescription drug market is very complex, and it's set up for that right there. And a lot of people say, oh, just let the free market work its magic. Well, there's no free market in healthcare.
That's right. There's not.
I mean, you show me, and I mean, I'll be surprised.
Yeah, there's not.
No.
I agree. So, all right, so you said you're going to the legislature to propose this cost-plus model. We got to go here, but where does the government? Where do they have? We'll save this till after the break. Just stick around, and we'll talk about that some more. We got. Can you stick around?
Sure.
Yeah, we got Robert Dozier, Executive Director, Mississippi Independent Pharmacies Association. I want to dig into that a little bit and see how government has a role here. We're in the studio. We're visiting with Robert Dozier, Executive Director of the Mississippi Independent Pharmacies Association. So, I found one of the more intricate diagrams of the pharmacy benefit management ecosystem. It's brutally complicated. I'm not sure the folks in the industry understand all the moving parts in it.
Well, it's true definition of the right hand doesn't know what the left hand's doing.
All right, so I wanted you to come back and talk to us about what you might be proposing to the legislature. Yeah. You said something about perhaps adopting a cost-plus model. So can the state just pass a law that would apply to those in the pharmacy industry?
In the commercial insurance business, yeah. The state could.
Because it's regulated?
Yeah, exactly. The state could. The Mississippi Board of Pharmacy, they're the ones that license and regulate register the PBMs here in the state of Mississippi. Most states, the Department of Insurance does, but here in the state of Mississippi, the Mississippi Board of Pharmacy does. They do a good job of it as well, too.
Okay.
The thing is, what we're seeing across the national level is exactly what we're seeing, say, with our state health insurance plan with our state teachers and employees. Mm-hmm. Representative Hank Zuber and Senator Walter Michel had several task force meetings over the summer and into the fall, and they are seeing an increase in prescription drug expense going up 20-25% every year. Well, the state can't continue to do that. The problem is this. The contracts that the state, and I'm not criticizing the state of Mississippi or any employee or anything, these contracts are so complex that they benefit the PBMs. Okay. Same thing in the private sector with these employer groups out there. Those contracts, they benefit the PBMs, the contracts that the PBM throws to the independent pharmacies and say, hey, you either sign it or you don't. And there's no negotiating one bit whatsoever. So the market is not a free market like you and I addressed a while ago. There's no negotiating right there. And that's the healthcare market overall. We were joking off air a while ago, and you showed me this flow chart, and it is very confusing.
It's crazy.
And I deal with this stuff every day. And what we were talking about a while ago, PBM stand for Pharmacy Benefit Managers, but in the real world, PBM really stands for Profit Beyond Measure.
Well, you get into all this spread pricing and the cost plus model that you were discussing. And that's what they call it, right? The spread game.
That's right.
Spread pricing.
The spread pricing is the true definition is what the PBM charges the employer group. And say they charge them $25 for that prescription. Then, in turn, the PBM goes and they reimburse the pharmacy $5. Well, there's a $20 gap right there. That's the spread. Well, the PBM keeps that. And that is just one source of their revenue. Then you start talking about the drug rebates that they get from the drug manufacturers. Well, when these drug manufacturers have to pay the rebate to be on the drug formulary that the PBM creates, well, what does the drug manufacturer do? They've had to pay this rebate. Well, they just tack it on to the price, and that gets down to the end user. That's why the cost of prescription drugs is steadily going up, because the PBMs are sitting here manipulating all of this complex system, and it's causing harm to the patients of the state of Mississippi and the country, and it's also causing harm to the business groups out there as well, too.
Well, the rebate model, just in general, Robert, that has been a bone of contention for some time, is it not?
Yes, it has. And I'll tell you this, once again, Senator Walter Michel and
Chair of the Insurance Committee, by the way,
that's
in
correct,
the Senate.
In the Senate, and Chairman Hank Zuber on the House side, on the Senate, the Insurance Committee on the House, they did a great job having these meetings. There was a gentleman that spoke from a totally transparent PBM. The name of the PBM is Capital RX. They do not collect any of the rebate money and keep it from the drug manufacturers. They pass it on to the employer group. They charge their clients a flat admin fee per prescription, whereas the traditional PBMs do not. And the other thing is they reimburse their pharmacies at a NADAC plus a professional dispensing fee model.
Okay.
Everything is transparent in this PBM right here. And they're slowly but surely gaining ground in the market share out there. The traditional PBMs do not like them. They're not real fond of transparency. It's like I was telling you a while ago, transparency to a PBM is kind of like sunlight to a vampire.
So Mark Cuban, owner of the Dallas Mavericks, a billionaire, made all his money on the creation and ultimate sale of broadcast.com. He was involved in inventing such technology back in the 90s, the dot-com boom. He knows this is a problem, and he's looking to totally upend it and disrupt it. Tell us what's on his mind there.
Well, he sees the problem, and he's going to a cost-plus methodology, and he's chipping away in the market share right now.
Yeah.
And you saw several months ago, maybe back in August, I think, maybe September, Blue Cross Blue Shield of California is going to start using some of Mark Cuban's plans and everything. They think that using Mark Cuban's cost-plus methodology will reduce their drug costs maybe by about $500 million.
Yeah. Now,
one thing that we need to talk about is specialty pharmacy. Specialty pharmacy are basically high-dollar prescriptions from the $500 amount on up. That's the real cash cow for the PBMs out there because they get to define what a specialty prescription is. And guess where the specialty pharmacy prescription comes from? Their own mail order house or their specialty pharmacy. So you have to get back to transparency.
It's too incestuous. It just is.
It is. And so we need to definitely move to a cost plus methodology. But the trick is, how do we define costs?
Yeah.
If you're going to go out there and have a true transparent model, you need to use a national benchmark that is set by an independent third party.
Agree. I could support that. And so I believe it's also true, is it not, Robert, that the state of California has either they're going to or they're looking very strongly at getting into the production of drugs themselves, in particular diabetes drugs. I've seen that.
I haven't seen that article.
The state literally get into the manufacturing business, the production of prescription drugs.
Number one, that kind of scares me.
It does me too.
That California is going to do that.
It does me too. You got government essentially competing with the private sector.
Yeah, and that I have not read that article yet. I haven't seen. I'll look for it.
Take a look at it.
Yeah, but I'll be honest with you. California kind of scares me.
Oh, I agree.
On that one.
Yeah, insulin is. I'm looking at it right now, producing its own insulin. That's on their radar right now. Actually, it says the governor announced a partnership, this wasn't too long ago, with Civica, a nonprofit drug manufacturer, to produce insulin for California residents. They're going to sell it for $30 for a 10-milliliter vial. Novolog. How about that? So I agree. That's kind of scary, but it has been enacted. So.
That's scary.
That's crazy, isn't it?
That it is.
So they've got a contract. This happened back in the summer. $50 million deal, working with this drug maker, Civica, to start making generic insulin later this year. Coming on board later this year. When you see it happen in California so often, the other big blue states, they jump on board. They follow suit in these kinds of things. I don't think it's a good idea for government to be in a business like that. I think that's just that concerns me. Mm-hmm. What's next? What's the next business that government's going to decide? I mean, that is more socialism, nationalizing of an industry.
But if we had a truly transparent prescription drug market out there that was a free market, so to speak, we wouldn't be seeing.
They wouldn't be looking for this.
No, we
yeah.
wouldn't be seeing things like this.
I agree.
We wouldn't have the Biden administration trying to negotiate with the 10 drug manufacturers out there.
I totally agree with you. I actually believe that one of the reasons, like I said earlier, that the big insurers, the top 5, as you know, insure like 85% of all the private coverage in the country. I mean, when you limit their profits, so you can't make any more than this, well, then they start looking for ways to expand that, to increase that. And so they stay in kind of their world, their industry, and then they start gobbling up their customers often or other third parties who make products that they insure. And so...
Would you say vertical integration?
It's vertical integration, and it's just tighter control of the ecosystem, which means less competition, less choice. It's just a bad deal. But that's because government started by intruding.
Well,
my philosophy on that, for what that's worth, not much. Appreciate you coming on.
Hey,
Rob.
good to see you again.
Yep, we're coming right back, folks, in the Element Well studio.